I was talking about existential direction. I was talking about Karl Jaspers, Ellen West. This is case of Ludwig Binswanger. Did I tell something else? Viktor Frankl. I explained to you about Viktor Frankl, about the meaning of life, logotherapy. Yes. Yeah. So this is also one of the theories, not really a theory in suicidal kind of direction. It's not a suicidal theory. I mean, it's not direct like that. But according to Viktor Frankl, if we don't see the meaning of our life, so there is no meaning, that means there is no anything that I can live for. That is why I can commit suicide. Maybe you know some other surnames from existential direction. We discussed sociological, so theories. Biological, I remember we discussed. So we discussed psychoanalysis. Yes? Did I tell you about Freud? And we stopped on existential direction. Did I tell you anything about cognitive direction? I can give you one name, actually. It's cognitive behavior therapy, Aaron Beck. He actually one of the representatives who was literally talking about suicide. So in that sense, he kind of looked at this phenomenon very close because he was a psychiatrist, and of course he had some cases in his private practice why people committed suicide. But try to think, do you know?
About cognitive distortions?
Yes, exactly. So this how actually he was looking why people are committing suicide. So my cognitive distortions, like if I think about something in a distorted way, this can lead me to commit suicide. He was a psychiatrist, actually, yes. I mean, in that sense, I believe he, of course, had to deal with people with schizophrenia. But in that sense, for example, if I think about myself, that I'm a bad person, that I do things wrong, what's the next step? So it's my thinking. So it's like I think about myself in a negative way. How do you think, what will be the next step?
Depression?
Okay, depression is the diagnosis, yeah. I mean, yes, I mean, that's, you think kind of in Aaron Beck's way, true, it's but what I'm trying to tell, it's like, if I have negative thoughts about myself, the next step, for example, I stop believing myself, and I become desperate, for example. And if I have this despair, so the next step, because I think, for example, myself again negative, so feelings and this emotional sphere and thinking cognitive sphere are confused and distorted, and in that sense I see myself in a really negative way. So one of the steps how I can solve this problem, I can commit suicide, because my distorted understanding of myself brought me to this. But the main idea is thinking. So that is why when Aaron Beck was creating his therapy, he kind of paid attention on your thinking. Yes. So because we have many mistakes of our thinking. We tend to generalize, for example, some thinkings like if I fail on this exam, that means all exams are failed, and it's like, oh, my life is over. No, I'm just joking, but you understand, the idea. So this is how cognitive direction, and Aaron Beck, I am talking about him, he sees, why people commit suicide. So you already see the difference. I mean, existential direction, they pay attention more on your meaning, values, on your life, the relationship with death, these things that can lead me to commit suicide. Cognitive behavior therapy, cognitive direction, they look on your thoughts, that is why we can commit suicide. Psychoanalysis, because I have this internal conflict, that can bring me also some problems and unsolved problems inside of me can increase this energy that Freud was calling as thanatos. Yes, and that is why I also commit suicide. What other direction in psychotherapy you know? Humanistic, I believe also, yeah, they see, I mean, I don't know exact examples, but if to think logically, yeah, in that sense, humanistic, if you kind of didn't achieve, I don't know, self-actualization, that means you feel in this world not like you kind of realize all your potential that maybe can bring you to suicide, but not necessarily. So understand, yeah, this seems. Do you know any other directions that we should consider here? I was telling you in last lecture that if a person commits suicide, you have to show this person to psychiatrist. This is rule here in all Russian-speaking countries. I mean, Russian-speaking countries were as part of Soviet Union before. But in the European United States, I don't know the rules. I'm sure that there are more than this series, but what I'm trying to tell you is about the main idea, the main thinking, how people were understanding this suicidal behavior. So you remember how we kind of understand suicide. This topic is very, very close to idea of death. Okay, and you know that in the world there are two kind of, maybe there are more, not only two, but in the field of suicide now, it's very popular to talk about several directions. So one of really famous theories belongs to Schneidman. Actually, he developed the idea of suicide when he was talking about ache. You know what does it mean? Yes, ache. It's like pain. So when he was talking about that people can commit suicide, you know, because we have this psychological pain. So it's not only physical pain, yeah, but sometimes I suffer from this, as we call it, psychological pain. So something that I can't feel on my body. Do you have such kind of maybe examples about this idea of psychological pain? So you understand the meaning of the word pain, yeah? Mm-hmm. Do you have some examples? If someone is dying, I feel pain, yeah, okay. Some other example?
When a lot of stress you have.
Mm-hmm. And you can't cope, you also feel pain.
Yeah.
Break up romantic relationship.
Yes, it's. I mean, it's painful. Yeah. Just why I'm laughing, because for teenagers, I was talking about these things. Yeah, last lecture maybe I didn't talk to you about this, because when, for example, you are in your teenage time, yeah, it's like you see the world black and white. So if something happened, that means like, wow, disaster. So if I broke a relationship with someone, so it's the end of the world, because it's my first breaking up. I mean, it's like it's really disaster, yeah. Or, for example, if someone is dying, it's not only about teenage, yeah, but if someone is dying and it's your first experience when you meet this loss, of course, it's very painful. So that is why sometimes I have such type of clients and patients when they are already adult and they are more than 40, for example, but no one died in their life before, so such things are happening. And they experience the first loss in their life. So it's very, very, in that sense, painful. So this first experience they have, and it's very painful. Understand? Yeah, this idea. So it's like, I mean, there are many other examples, but you understand the difference between physical and psychological pain. And how do you think which pain is easier, physical or psychological?
Physical.
Physical? Why?
I guess not.
I guess equal.
Equal?
Yeah.
If equal, then why? If physical, then why? Just try to explain your answer. Why do you think like that?
Physical pain, it's произошедшее. Psychological
Okay.
So, but in my opinion, it's equal because it's connected with each other. And if you have some mental pain, like mental, psychological pain, then it will be проектироваться in your body and like physical and vice versa.
Have you heard about self-harm concept?
Yes.
Yes, it's about physical pain, but why these people, in that sense, do self-harm? Why do you
Result of
think?
psychological pain.
Because of psychological pain.
Yeah.
So in that sense, if you really can sense, feel something with your body, it's always easier to cope with these things. When we are talking about psychological pain, because we can't touch it, we can't feel it literally. So that is why sometimes when people have this psychological pain, and it's especially behavior that we have in teenage, or maybe when small children also before their teenage, they do this self-harm. They do it because they can't cope with the internal pain they have. And to, as you mentioned, to project, to act out this pain from my soul on the body, these things kind of help me to reduce the psychological pain. So that is why we are talking about self-harm behavior. So it's not necessarily just to, for example, suicide, not necessary. Because do you know, by the way, some examples of self-harm? It's kind of really not rare phenomenon now. Do you know these people? Did they stop their behavior now? Did they stop to do this self-harm?
I guess it's because of that time, teenager time, when they have like this disaster thinking, but now sometimes
disaster, distorted, you mean?
Yeah.
It's like life was disaster. I'm just
but
joking.
sometimes now she has also has this depressed mood or something, but she is not self-harming herself.
How old is she now?
21.
She's your age, yeah.
Yeah.
And eighth grade, how old was she?
Сколько получается?
8. 12?
12,
14.
13 maybe.
So you see how it's working. Okay, now she already has maybe inside of her enough resources to cope with this psychological pain. Maybe some experience, I don't know, maybe something that she was not able to reach inside of her before. Now she can, in that sense, help herself to cope in a different way. But it's very sensitive age, yeah. When you are 12 or 13, you don't know many things about the world. I mean, you know, but it's not like, for example, when you are 45. Yeah. So, and self-harm usually people started in young age. That's true. But she stopped. But not everyone really stopped, because they sometimes do this self-harm, like cutting. So the idea, I cut myself when I can't cope with the psychological pain. So it's so unbearable that I don't have any resources. For me, it's easier to, for example, to reduce the psychological pain with physical pain, because when I physically, literally can feel it in my body, it's plus some hormones, of course, there is some idea of physical pain here, and it reduces my psychological pain, and I kind of feel myself easier. And sometimes it becomes, behavior becomes very addictive. So talking about addictive behavior. So next time, for example, when I again near to feel the psychological pain, I don't want to feel it, and I have already this mechanism how I cope with this psychological pain, and I again, for example, cutting myself, and many kind of time I repeat it, and you understand it's like addictive behavior. This behavior is sometimes really addictive. So it's a mechanism of addiction. And what I'm trying to tell you, so sometimes this, as you are telling, this behavior goes to another direction, and people are trying to do this self-harm not in a literally physical way, but they start, for example, drinking, they start to do some extreme sports. So this is not direct idea of auto-aggression, to be honest. Remember, we are keeping this idea. Suicide is very, very close to aggressive, but behavior is auto-aggression, yeah? But sometimes it becomes literally like addiction. So, and these people, they can't stop. And if you see such teenagers, so that they have a lot of cuts, yeah, in their hands, and sometimes they hide in these cuts, yeah, under clothes and etc. But it's very, very kind of often we can meet now this idea of self-harm. You know that when people do this tattoo, yeah, it's an art from one side, but if your whole body, yeah, covered with tattoo, you know, it's also considered like self-harm. It's one of these behavior. It's about psychological, but not necessarily like that, because now it's a fashion and trend, of course, and some people, yeah, they follow this trend that I want to have this tattoo. But some people, I know that they kind of so afraid of physical pain that they refuse from this idea to make tattoo, because physical pain is very unbearable for them. Understand? So they refuse from this idea. But if we are talking about suicidal behavior and about Schneidman's theory, yeah, that idea that I have psychological pain, that I can't cope with this psychological pain, yeah, and the next step, it's like I have cognitive distortion, yes, about myself, yeah, about I understand the scenes, yeah, and people, for example, they do this self-harm and they think, oh, it helps me. So it's like cognitive distortion. It's not necessarily like that, but idea, the next step is cognitive one. And other step, Schneidman, he was telling that if, for example, plus all these things, yeah, plus my psychological pain, my distorted thoughts, yeah, I feel that I don't belong to, I don't know, society, that my close significant others, let's call it like that, will continue in psychoanalytical tradition. I mean, the good word, this good, I mean, not word, it's expression, yeah, significant others, people who are very important to me, yeah. And if I feel that they don't need me, so it's not necessarily like that, but it's my perception of this, yeah. And it's like the next, yes, step will be, it's like, okay, there is in my mind something ambivalent. Yes, so it's like plus and minus, and we remember from psychoanalytical school, plus and minus, that means tense, yes, it's energy, understand? So it's like his theory is really, really close, yeah, I mean, in that sense, to psychodynamic direction, to my point of view. And so the next step, plus all these things, because of ambivalence, because of psychological pain, because I feel that I mean, no one needs me, and etc. So the next step, what will be? Suicide. So it's not necessary, but he considers this idea of suicidal behavior, because, for example, sometimes in these theories of suicide we can see only one side of this behavior. It's about our internal thinking. Like, for example, in Beck's theory, I kind of think distorted, and it leads me to many kind of things, and I commit suicide. But here you see what Schneidman he did. He showed that not only my internal understanding, my thinking, yes, my psychological pain, but external reality also can play, in that sense, huge role in the attempt of, if I attempt or not, suicide. So sometimes it's literally in my head that I don't feel that I need to someone, yeah, but sometimes it's literally like that. So the person can be denied, yeah, from society. Such things may happen, for example, in prison, you know, yeah, that in prison people are also often commit suicide. So you understand, yeah, this idea. See the picture, it's a little bit different. You see external plus internal things here and here. So his theory actually made a huge influence on these theories that we have now, as I told you about, because this was last century, yeah? And he showed another side of the suicidal behavior. Yeah? It's like your surrounding plays huge role, yeah, in that sense, in the attempt of you commit or not commit suicide. But later in 2005, I believe, yeah, they were invented another theory, and the name of this guy who described this theory was Joyner. It's very popular now in English-speaking countries. Thomas Joyner. So they call it personal theory of suicide. Thomas Joyner. So because of this, actual ideas of Edwin Schneidman, it gave some influence on the appearance of this interpersonal theory of suicide. Because you see in the name of this theory, interpersonal. It means people play a huge role in committing of suicide. It's not only about my how to say, internal thinking, yeah, or internal conflict, but people are playing a huge role in that sense. And so he actually had some key components, yeah, in this theory. The first one, he's talking about this feeling of burdensomeness. So that means like something like very, very heavy, unbearable, yeah. So it's like a burden. Understand? Yeah, this kind of idea that to commit suicide, one of key components of this idea that I can commit, suicide, I have to have this feeling of burdensomeness. Have you ever experienced such feeling in your life? No, it's okay if you didn't. Of course, it's okay, because if you kind of telling me now, yes, we feel it every day. So of course, the next step, okay, we have to do some prophylactic of suicide in your group. But maybe you know some people that kind of tells you about these things. Do you have experience in your life to meet with this feeling of burden? But it sounds very heavy already, you see, so it's good that you don't have such experience, because according to Thomas Joyner theories, if you have it, it's already one step to suicide. It's one of the components, yeah, the idea that they can commit suicide. So the other idea is that I don't have this people that are near with me. I have them, but it's like I feel that I don't belong to them. It's like this absence of the idea of belongingness to people, sometimes to humankind in general. It's not necessary to my family or to my friends. In general, sometimes people feel this that they they don't have this feeling that I belong to some group. Yes. Did you maybe had experience to meet with such phenomenon, let's call it like that, in such state? Maybe some from your friends were complaining. Maybe you felt it yourself. I don't know.
I guess it's more that they left this country to another and live there, and в многих местах, in different places, and then they don't know like where I belong, but they don't want to come back to Kyrgyzstan, but also there they have feeling of no belongingness, and it's a problem.
It's like thwarted belongingness, he calls it in that way. Yes, and if you remember the theory of Angelina Demilkhanova, remember I was talking about this anomistic suicide. Is when, for example, I can't adapt, I can't cope with new norms or the other norms. I mean, the old norms died, changed, and etc. So in this state, people are committing suicide often. But Durkheim was thinking in a sociological way. Yeah? He kind of saw the whole society. But here we see this theory from perspective of psychology. So it's not about crisis that there is in society. So it's like you're telling someone is moving to another place, and he doesn't feel that he belongs here to this new group, and he's not accepted by other people. So we can feel it. I often, to be honest, hear this from my patients who kind of suffer from drug addiction, and when they were young, they moved to Germany from Soviet countries. Yeah, so they originally their native language was Russian, but they moved to Germany, and because they were not accepted by the society where they were living. They started to use drugs because they were not able to cope with this psychological pain, as we can call it like that, yeah, now. And they started to use drugs. And sometimes, for example, they started to use drugs not only, I mean, plus they had this, of course, feelings, heavy feelings, but because kind of some groups that already existed there in Germany, that was a cultural norm for this group, if I can say like that, yeah, that they used drugs. So, and I become, for example, part of this group of drug addicts, and then I can realize, yeah, my feeling of belongingness. But to be part of this group, I have to use drugs. Understand? Yes. So sometimes we can see this not direct, yeah, auto-aggressive behavior. So understand, yeah, this idea of the next key component of this theory is like thwarted belongingness. The third one is, he called it like acquired capability of suicide. How do you think, what is about acquired capability of suicide? I have capacity, yeah, to commit suicide, and when I can have this capacity, but because not everyone can have this capacity. Yes, exactly. Because it's like I'm kind of forming this ability to be more able to suffer from this physical pain. Yes, so it's like capability to do this suicide. Because some people, they don't commit suicide, as I mentioned before, and they don't do this tattoo because they really afraid of physical pain. And if you even have this feeling of belonging, I mean that the feeling of absence of belongingness, yeah, that feeling that you are burdened for this world, for others, and you don't have this ability for suicide, you are very afraid of, for example, death and pain, it's not necessary you commit suicide. But if you already have some experience with pain, so, and you have some special relationship with death, as we were talking about last lecture, remember when we discussed this Japanese culture, because they were educated, and I believe they still are educated in such a way that death is part of life. Of course, I mean, how to say, it is like that, that death is part of life, but the relationship in Japan to death, it's a little bit different, yeah, in that sense they kind of somehow show you this attitude that, yeah, to kill yourself, like samurais did before, it's kind of part of culture, understand, yeah? So that is why maybe in their culture, we discussed, yeah, this last lecture, people more tend to commit suicide. So, and kind of according to this, you see, yeah, this key concept of this theory, and if I have these points, let's call it like that, if I have all these things, that means I can commit suicide. And how it can be useful for us from, for example, psychological or psychotherapeutic perspective, to know these key components in this theory. It's very popular now. I told you it's very popular theory in the world. It appeared almost 20 years ago, but now it's very, very kind of popular theory in suicidal behavior in English-speaking countries. How do you think this can be helpful to us?
To prevent
suicide. Yes. To prevent. So how can we do this prevention?
even here maybe we will see some step like burden during the session, and we like notice maybe she has suicidal thoughts. Suicide thoughts.
And it's not only about individual counseling. So for prevention, that means you can, for example, organize some events for, I don't know, for schools, at younger age, to help people to cope with this, how to say, to help people to cope with difficulties in their life. Because as I mentioned before, when you are young, when you are teenage, it's kind of more often you can choose this way to end the life because of many reasons, but you don't know how you can cope, for example. So for prevention, of course, and if you do counseling, for example, you can pay attention on these ideas, how a person can be, for example, part of this group, I don't know, to cope them, to adapt if it's a person who are in another country now, culture, so understand this idea. So it's really, I mean, this theory of Thomas Jr. is really good in that sense. It's like the perspective they see, it's not very, as we mentioned before, it's not very in that sense like clinical, because when I kind of ask you about suicide, we already know this since you usually answer me is like, oh, some psychological diagnosis, psychiatric, diagnosis. But in that sense, I mean, it's this theory sees a person a little bit wider than diagnosis. So it doesn't mean that I don't have diagnosis, it doesn't exclude these things, but anyway, if even I have, and in that sense you can prevent me from committing suicide if you know these targets, let's call it like that. Okay, did you get it? Yeah. I want to tell you another theory, very influential to my point of view. This theory was developed actually in Soviet Union, in Russian-speaking countries, and this theory was it appeared, if I'm not mistaken, in last century, in 70s. So the name of the scientist who kind of described this theory, she actually really believed in the theory of activity. You know that we have this theory in Russian-speaking countries. In Soviet Union, there was very, very famous idea, the theory of activity. So the theory of suicide by Ambromova. So as I told, she based on the idea of understanding our life as activity. This idea, the theory of activity that belongs to Leontief. It's very influential school in Russian-speaking countries. And I don't know about now, but they had many years of this department in the Ministry of Psychiatry in Russia. So they treated people with suicidal behavior. So she's a psychiatrist. You have to understand that, since if, for example, you are a psychologist, I told you that you can work with a person who committed suicide, but anyway, you need some help and some assistance from psychiatrists, just in case, because people who committed suicide and it was not successful, he can repeat this attempt. So how she sees this suicide, so it's actually the how to say, it's like classification of suicidal behavior. It's like steps before you can commit suicide. Yes. So our behavior, according to her perspective, can be divided on two parts. It's like internal behavior and external behavior. And for example, internal behavior, what includes? We are considering this internal behavior from perspective of suicide. How do you think? If I'm talking about internal behavior, what's the first step that can somehow show me the way to end this life? Internal behavior, what the first part of this classification step? Internal, it's in my mind. Thoughts, yeah. The first thing is like my thoughts, but thoughts about suicide. But you know, yeah, that it's normal to think about suicide. So it's not like that if you once thought about suicide, you can commit the final step in the external behavior. Yes, you know that it's normal. But if it's kind of becoming normal every day, so it's like, you know, it's like some development of these thoughts. The first, it's like I have only thoughts about suicide. Can you give me an example? It's not always direct thoughts. Suicidal thoughts, what it can be.
For example, in childhood I had like many times, I guess, at school, when not many times, per year, once a year, like what if I will die, like my mother will cry, or
yes, it's something.
Мои друзья придут плакать.
It's something like that, or if I will die, or what will be, for example, if I wake up tomorrow and the bomb will kind of destroy the whole city, what will be, understand, yeah? It's not always like, what if I die? So something can happen, then I die. So it's kind of thoughts about, suicide. The next step. So at first I'm kind of thinking, yes? The next step, how do you think, what is the next step that can lead me to commit suicide?
In internal, yes?
It's internal, yeah. We are still considering internal things.
I want to do this.
So it's direct. I mean, it's a good direction because, for example, at first I'm thinking, but then it's like there is something that I'm not doing it yet, but already I have some intention. And the next step, it's like they call it suicidal ideation. Okay, so it's like I have thoughts, but ideation, that means I'm already near to make this idea in external behavior. So in Russian language we have this word замысел. Понимаете, да? То есть на русском вообще это называется суицидальные замыслы. So it's like I'm already creating something. I'm already creating something in my mind, still in my mind, to make this thing happen, that I can die, for example. So you're telling, I was thinking, if I die, what will happen? So the next step is, okay, I have to create something that I can die, understand? So this, they call it as suicidal ideation. Okay, the next step, it's still in my internal behavior. How do you think?
If ideation, maybe how he will do it?
It's like intention already, yes. The third step is already a suicidal intention. Understand? So it's like already intention, what does it now? Already create really the way how I can do it. Yeah, maybe, but it's still in my kind of, in my mind. So it's internal behavior. And the next step is already an external behavior. And what it will be, how do you think the next step? So you have to understand that the person who decided to commit suicide, he doesn't necessarily to do it demonstrative. So if, for example, I decide to commit suicide, and I already took this decision, okay, it was at first in my internal perception. Now I already have something, as like my decision is already near in real world, so I already near to do it. So it's not necessary I will tell you. So if I'm creating a plan, so I can create a plan. So that means the next, understand? It's not necessarily like, oh, I want to commit suicide, look. No, sometimes people commit suicide, no one even knows that you have this idea in your mind. And it's not necessarily 1 year or several months. Sometimes this idea can be several years. So it's not really direct in that sense. You have to be very careful with this idea.
If he or she start to behave like more politely with close people or isolated.
Yeah, it can be like that, yes. It can be like that, how this person behaves with others, but we are considering this Ambromova theories, it's a classification of suicidal behavior, it's like steps, yeah? So first it's like internal world, and when, for example, I already have this idea that I already created some kind of plan, so I have intention already to do it. The next step in external behavior, I'm kind of making some preparation in that sense of suicidal behavior. So it's like you're saying, I'm stopping to talk maybe with some on opposite. I'm kind of very polite, and it's like trying to communicate, yes, with others. So it arises. So the next step is like external forms of suicidal behavior. First step in this external form is preparation for suicidal behavior. Preparation, okay. The next step. How do you think what will be? So I'm already preparing in my reality, not in my internal reality. I mean, in this reality.
No, your final step. Suicide.
Yes. Final, it's suicidal attempt. So it's attempt, but it's not necessarily final, because you see, sometimes people attempt suicide, but they don't die, and then think, oh, what I did, I was wrong. So it's like I was stupid, I was weak, and etc. Yes. So sometimes it can be like that. But the third step is completed suicide. So understand? Yes. So second attempt, and third one committed suicide. Not committed, sorry, completed suicide. Completed suicide. That means death. Not always, but I mean, after attempt you can survive. But if you kind of really finish this, you kind of finish this. Did you get it? Do you have any questions? So what they do, I'm in this center of suicidal behavior, this theory, they also consider not only the steps of suicidal behavior, they also kind of see different meanings why people can commit this suicide. Understand this idea? Different meaning why I can do it. The first one is I can commit suicide because of protest. I kind of want to show you something. I go against against I don't know the rules, against something. Understand? Yes, this idea. Another one, I'm not sure that it's also kind of good translation. Appeal. I'm not sure this is good translation, because in Russian it will be like that. The first type of personal meaning, тип личностный смысл. Первый это протест или месть, so protest or revenge. The first one is protest or revenge. Yeah. The second one is призыв. It's translated as appeal. So it's like the second one. It's like I'm asking. So if to give it in a little bit different way, I'm asking to people to pay attention on me. Yeah, it's like I'm appealing to their attention. The third one is I'm trying to avoid something. Avoid, that means maybe I have to be punished, yes, and I have to pay a lot of money, and I know that these people will try and will try to kill me, yes, for example. This also can be one of the meanings or motives why I can commit suicide, so avoidance. Another one is self-punishment. I think here is everything clear for you. And the other one is like denial. So I deny something in my life. That is why I can commit suicide. Did you get it?
Yeah.
Do you have any questions?
No.
So the next thing that they consider in this theory and what they do in this center, for example, if you already committed suicide, but you're alive and you're already in our hospital, we are trying to evaluate your state. Yeah? So the first thing we are trying to understand, for example, your relationship to this attention. And how do you think the relationship can be to my attention, to my attempt that I tried to commit suicide? What can be the relation? It can be different one, to be honest.
One of them, it could be like, wow, I did, and I will not do it again.
Okay, yes,
A
yes.
second one, it's like, yes, yes, and I will repeat.
So, okay, one of the things, I mean, my attitude, what I did, I can be really critical. And for example, oh, what did I do? I did something that I didn't have to do. And in that sense, if I'm very critical to this attention, how do you think, what chances that I can commit the suicide again?
Low.
Very low, yes,
Yeah.
because I'm critical to my attention. Understand?
Mhm,
Yeah, this.
yeah.
Another relationship, for example, it can be manipulative. Yes, that means if I have this idea that my suicide, my attention is manipulated, that means I can repeat it again. Understand?
For
It's like
example,
because
towards parents. Like,
yes, it's like okay. So you and for example, when you kind of do this evaluation of a person, yeah, who wants to kind of not wants to, but if he wants to or doesn't want to commit suicide, you have to understand his attitude. So if it's manipulative, that means the chances
still.
are high. Okay, another one, it's like person can be very, in that sense, analytical. Yeah, so he is kind of understanding that I did this because of this. It's not critical, it's another word, analytical. Yeah, it's another relationship. So I can analyze why I did it. Yes, I was not able to do it in a different way. And how do you think, what chances that I repeat it if my attitude to suicide is analytical?
50-50.
Yes, but anyway, you have to be careful. So it's like you have to understand, yeah, it's like if, for example, the relationship to the idea that I committed suicide, to attention that I kind of did critical, that means
Low.
the next attempt is very low, yeah, because I'm critical, I understand what I did. But if it's analytical, I mean, I understand why I did it, I can analyze, and for example, I can answer on the question that I didn't have another way, so it's like I understand that it's bad, but anyway, I don't see another way how to cope with this psychological pain. Understand, yeah, this idea? So you have to be very careful with this person when you do this assessment. That means he can repeat, yeah, this attention. And the final one is suicidal fixed. What does it mean? I mean, in this words you can fixed, suicidal fixed. Суицидально фиксированно, так и называется. Fixation on suicidal.
It means he will repeat again?
Yes. That means, I mean, I know that I did this attention, it was unsuccessful, but anyway, I don't see the other way how to do it. Not necessarily addiction, I mean, anyway, it's like if we remember this meaning why I trying to commit this, yeah, why I'm trying to attempt to commit suicide. For example, if it's, I don't know, my idea to avoid something, to escape from punishment, and if I, for example, know that let's imagine such situation, the gangsters will come and anyway will kill me because I owe them many things, much money, yeah. I don't see another exit. So, and how do you think if such type of relationship, what does it mean?
Also will repeat.
Yes, it's
Try
almost
again.
100%.
Yeah.
So it's suicidal fixed. You have to be very, very careful with such type of people. That is why, you see, that is why different relationship to the attention of suicide, and that is why these people have to be kind of in a special place in the hospital. So in hospital, I'm telling you the theory of Ambrumova, and in the hospital they do it, they evaluate. For example, if you are critical, yeah, okay, so it's like we kind of can let you go, yeah, in that sense, but in that kind of way, not everyone is very critical. I remember I was telling you about Ellen West last lecture, so she was suicidal fixed. And they did many things, yeah. The doctors that were near with her, many years. It's not like 1 or 2 years. It's literally 20 years. I don't remember. So it's 10, 15. So it's many years. I don't remember exact quantity, but the idea is, so anyway, she was suicidal fixed on her attention. And I told you that they anyway finally took this decision to let her go. But when we had this case, it was first kind of part of 20th century. There were no medication yet. There were no so kind of how to say, there were no so huge classification of some diagnoses because they were not able to put diagnosis on her. Maybe if they kind of were able to put a correct diagnosis, it was easier for them to treat her, but they were not able to do it because psychiatry was not developed as it developed now, yes. So that is why this example we have, she committed suicide, you know. But for example, if you are talking about nowadays, and what I like in this theory of Ambrumova, you see they have different understanding of this suicide. So not only steps how you can commit suicide, but also why you are doing this. They try to evaluate the relationship, yeah, with others and the relationship of yours to the attempt you did. And in that sense, the next step I can help you because we can divide, yeah, in that sense, in time, the suicidal behavior on this post-suicide. We call it like post-suicide. So that means if, for example, I committed suicide, the earliest post-suicide will be 1 week. 1 week. So, so it's 1 week later. Next one, early post-suicide. 1 month.
1 month?
Yes, and the latest one, 5 months. 5 months. Understand? So that is why you have to be very careful with the person who committed suicide but was not successful. Nearest attention he can do in 1 week, then 1 month, and like the latest one is 5th month. It's especially about if I suicidal fixed on my attention. Okay, but if I'm manipulative, okay, you have to be careful. But anyway, it's not so high. If I'm critical, so comparing to critical one. If I'm critical, okay, you can wait for 1 week. You can do some psychotherapy with me. And, I don't know, to prescribe me some medicine. Yeah, maybe because sometimes people really commit suicide because they in a depressive state. It's literally diagnosed. Yeah. But you have to be very careful with this person. Yes. Do you have any questions about this theory? Do you have any questions about other theories that we discussed today or probably last lecture?
About the steps of suicide, people who try to, like, every person, like, do these steps before
No, no,
committing
no. I'm telling. Yes, in that sense, yes, of course. Because it's if you, for example, you are on the first step of your internal behaviors, like I have my thoughts about. I have the thoughts about suicide. It doesn't mean you will do final step, of course. Everyone has thoughts about suicide. So to commit suicide, you have to go some way. So it's not if I'm here, I can't even jump from the window. I need to do some steps to jump from the window. Understand? So that is why I really like this Brumova theory. It's pity that I didn't find any translation into English of this theory, because, for example, I was telling you about Thomas Joyner's theory. He was translated in many languages because he is very famous now, but the theory was invented in English-speaking countries. But in Russian-speaking countries, she's really the best one. So I didn't see any theories or any, not only theories, any understanding of this suicidal behavior better than she did. So I really recommend you to read more, because they have special, guide for people who are working with suicide. How do you think, can you notice that person can commit suicide, and how you can do it?
Not always we can define.
And, also, Ambrumov was talking about, she also described this experience that we call antivital experience. That means you can hear from this person such talk that my life doesn't have values. Yes, it's like I kind of yes, some behavior, some like drugs and alcohol, some danger behavior. We call it like autoaggressive. It's not direct suicide. Yeah. And for example, now theories, yes, of Joyner and Schneidman. If a person complaining about his psychological pain, that I don't belong to humankind, I don't belong to anywhere. So this is high risk to suicide, and you have to be very careful. For example, if person, I told you this since last lecture, if person already has attemption of suicide in my life, that means I can repeat it. So the risk is higher. If someone of my relatives or someone who kind of raised me, so if I already have experience in my life that someone committed suicide, my kind of chances that I can also do it is also higher. Understand? If, for example, I now don't have enough internal resources, and it's like objectively I don't have job, for example, I don't study, I don't have money, etc. So in that sense, I also can. Yeah, it's not necessary I will do it. We have to kind of do some steps, but it's like the risk is higher. Mm-hmm. Understand? So you sometimes it's not literally like that I'm telling that yes I will commit suicide, but sometimes you can pay attention, or not such direct signs. But if it's your client or if it's someone at school where you work, you have to evaluate these things very careful. If there is attention, someone did some attention, that means the risks are high. You have to be more careful to this person. Okay?